This film on antenatal care during delivery is meant to show what is required to be done during pregnancy and the care and precautions to be undertaken at the time of delivery. Good health is more than the absence of disease. Good health means the well-being of a woman's body, mind and spirit. A healthy woman has a chance to fulfill all of her potential. Plus, she will have healthier babies, she will be better able to care for her family and can contribute more to her community. This also helps to ensure that a woman's health problem is almost never her problem alone. Women's health is a community issue. How to tell if a woman is pregnant? She misses her monthly bleeding. Her breast feels sore and grow bigger. She feels sick in her stomach and sometimes vomit. Her pregnancy confirmation is done through her urine test conducted either at the sub-health center or a PHC. When the pregnancy is confirmed, the antenatal care for the woman first begins with her registration at the Anganwadi center or through a health activist or an ANM. How to know when the baby is due? Add 9 months plus 7 days to the date when the last normal monthly bleeding began. The baby will probably be born any time in the 2 weeks before or after this date. Antenatal care is provided by the health activists or ANMs who monitor the health of the woman during pregnancy, as well as the health and development of her baby. It can help predict possible problems with the pregnancy or the birth so action can be taken to avoid or treat them. The fixed nutrition and health day has been introduced in every village to provide regular health checkups for pregnant women from conception till the delivery of the baby. There will be at least 4 checkups. First checkup is at the time of registration, second at the 6th month of pregnancy, third at the 8th month of pregnancy, fourth at the 9th month of pregnancy. The health activist or the ANM checks blood pressure, checks the growth of the baby in the womb. Normally, the womb will grow 2 fingers each month. At 4.5 months, it is usually at the level of the navel. If the womb seems too small or too big or grows too fast, it may mean there is a problem. Check the hands and face for swelling. Checks the eyelids and fingernails for signs of anemia. Asks about past pregnancies and births, including any problems such as lot of bleeding or babies that died. This information can help both the pregnant woman and the ANM or health activist prepare for similar problems in this pregnancy and birth. Gives iron and folic acid tablets which help prevent anemia and birth defect. Checks whether the baby is healthy. She may listen for the baby's heartbeat. It may be possible to hear it by putting one ear against the woman's abdomen or with a stethoscope. Another sign the baby is healthy is if the mother feels the baby move every day and if she has felt it move on the day of the checkup. Gives vaccinations to prevent tetanus, a disease that can kill both mothers and babies. Gives tests for HIV and AIDS along with other sexually transmitted infections. Ensures that the pregnant woman is eating well enough and suggests ways for her to eat balanced diet. If necessary, she will enroll the pregnant woman in the nutrition center. Staying healthy during pregnancy. A healthy diet and lifestyle during pregnancy is important for the development of a healthy baby and may have long-term beneficial effects on the health of the child. The pregnant woman should eat enough nutritious foods. Good nutrition gives strength, prevents infection, builds a healthy baby, and helps reduce too much bleeding during birth. Remember, she is feeding both herself and her baby. A healthy, balanced diet contains cereals, pulses, starchy foods like potatoes, green leafy vegetables, meat, poultry, fish, eggs, milk, butter, and curds, and fruits. She should use iodized salt in her food. She should drink plenty of fluids such as water and fresh seasonal fruit juice, preferably at least 2 liters every day. This helps the body to get rid of toxins and waste products and can also help to prevent constipation and nausea. Many women develop anemia during pregnancy, which can happen when the body does not get enough iron. Iron helps to carry oxygen in the blood of the mother and baby. Eating a diet containing plenty of iron-rich foods such as green leafy vegetables, cereals and pulses, liver, fish, peas, papaya, mangoes will help the woman maintain good health. Safe drinking water is an absolute must. Poor nutrition is the most common and disabling health problem among poor women. Without enough good food, she may begin to suffer from general poor health, including exhaustion, weakness, and anemia. If a woman who is already malnourished becomes pregnant, she is more likely to have serious complications with childbirth, such as heavy bleeding, infection, or a baby with low birth weight. But the most common health problems women suffer from are poor nutrition, pregnancies that are too close together, and overwork. Each of these problems affects a woman's general health and wears her body out. Pregnancy also makes certain medical problems like malaria, hepatitis, diabetes, and anemia worse, just as they make pregnancy more difficult. The average weight gain in pregnancy is 10 kilos to 12 kilos. Pregnant women are advised to wear loose and comfortable clothes, checking the baby's position. During pregnancy, it is common for a baby to change position several times in the womb. By the end of the pregnancy, the baby should be lying in the womb with its head down. This is the best position for birth. To make sure the baby is head down, feel for the head using both hands. Just before birth, a baby will move lower in the womb to get ready for birth. So, late in pregnancy, you may not be able to feel the baby's head move. A woman's first baby sometimes moves lower about 2 weeks before labor begins. Second or later babies often do not do this until labor starts, and its head is harder and more round. Pregnant women should be advised to sleep and rest whenever they can, do their daily work, but should strictly avoid carrying weight. Have a daily bath and wear fresh clothes. Regular exercise is also important to maintain fitness and prepare the body for labor and birth. Preparing for labor and birth. If the pregnant woman suddenly goes into labor, the ANM or a trained dai should be around to help with the delivery. She will require clean cloth, sterile string, new razor blades, soap, and hot water. Arrange blood in case of need. Arrange health risk fund. Have telephone or mobile phone facility to arrange transportation to go to the hospital. Have a clean birthplace. Helping a woman give birth. If a health activist or ANM is helping a woman give birth, she reassures the mother not to be afraid. Remember, that most babies are born without problems. She stays calm and cheerful and lets the woman know that she trusts her ability to give birth. She keeps her nails clean and cut short. She washes her hands with soap and clean water and lets them dry in the air. She treats her with kindness and respect. First stage of labor. After completion of 9 months, the fetus begins to descend in the pelvic cavity. Although the woman feels a sense of relief in her chest region, she finds it cumbersome to move about, sit, or stand for a long time. When the time for labor comes, the woman experiences pain in her abdomen as the womb begins to contract. As a result, the mouth of the womb opens up and the fetus is pushed down. What the pregnant woman could do? Inform the DAI or the health activist or the ANM immediately. Try and relax and keep moving. Rest when she feels tired. Take the pains gradually as they come. Do not apply force. Take deep breaths. Drink plenty of energy-giving fluids like hot milk, etc. Ask the DAI or other woman to massage her back, abdomen, thighs. It is advisable to deliver the baby in a hospital. If the woman is in labor for the first time, this stage lasts for 10 to 12 hours. If it is for the second time, it could be 8 to 10 hours. What should not be done? Do not push or apply external pressure on the abdomen to hasten the labor. Do not break the amniotic sac with nails or blade. Do not give injection to speed up the labor. Do not insert hands or other substances in the vagina. Second stage of labor. In this stage, the pain becomes stronger and unbearable for the woman. The interval between two contractions decreases. As a result, the woman could scream in pain. This proves beneficial as it helps the baby to come down. The mouth of the womb opens up and the bag of water breaks. The head of the child is visible at this stage. Gradually, the contractions become more severe and frequent, and finally, the baby comes out. What she should do? Sit in a squatting position. It helps the baby to come out fast due to gravitational force. Bear down when there is contraction. Support the perineum with a cloth pad. Wrap the baby in a cloth and put it to breast immediately. Cut the cord after pulsation stops. What not to do? Do not pull the baby out with force. Do not cut the genitals of woman with a blade to broaden the passage. Do not push or apply external force on the abdomen. Do not insert fingers to examine the vagina. Precautions for the ANMs and health activists. Protect yourself from HIV and hepatitis by wearing clean gloves during a birth. If you do not have gloves, use washed plastic bags. Warning signs before pregnancy begins. An interval of less than 2 years since the last birth. Mother-to-be is less than 18 or more than 35 years. Mother-to-be has 4 or more previous children. Mother-to-be has had a previous baby weighing less than 2 kilos at birth. Mother-to-be has had a previous difficult or cesarean birth. Mother-to-be has had a previous premature birth. Mother-to-be has had a previous miscarriage, abortion, or stillbirth. Mother-to-be weighs less than 38 kilos before pregnancy. Mother-to-be measures less than 154 centimeters in height. Warning signs developing during pregnancy. Failing to gain weight, at least 6 kilos should be gained in pregnancy. Paleness of inside eyelids. Inside eyelid should be red or pink. Unusual swelling of legs, arms or face. Signs that mean doctor's help is required. Bleeding from the vagina during pregnancy, fits or convulsions, severe headaches. This is a sign of high blood pressure, acute vomiting, high fever, abnormal heartbeat, stomach pain, swelling of vagina or infection in vagina, breech, waters break but labor does not start, baby lying sideways, bleeding before the baby is born, too long labor, green or brown waters.